Bonjour les amis. Eh ben, j'ai eu ma vidéo que nous a faite Eric Berg sur tout mon parcours. Il a étudié sérieusement tout mon dossier médical pour arriver à comprendre ce que j'ai fait, ce qui d'après lui, m'a sauvé et ce qui a fait disparaître mon cancer. Alors, vous avez deux écoles. Vous avez l'école d'Eric Berg, de Thomas Seyfried, de Jean-Marie Dessin, qui dit, oui, plus de traces de cancer. Et vous avez la deuxième école, mes oncologues qui, eux, me disent, ok, ça va mieux, d'accord, mais bon, le cancer, il t'attend au tournant. Laurent Schwartz qui me disait par exemple que les gens comme moi meurent en 4 jours une fois que le cancer explose. Mon oncologue du premier hôpital où j'étais qui m'a dit tout ce que vous faites ne sert à rien, c'est extrême, ça sert à rien, toute la souffrance que vous imposez, puisque de toute façon l'échéance elle sera là et ce que vous aurez gagné, c'est que vous allez mourir en bonne santé. Alors j'ai toujours un peu apprécié cette phrase, parce que ça veut dire quoi, mourir en bonne santé? Il nous a répondu bien sûr en disant que extérieurement je vais bien, tout va bien, et le cancer continue son petit bonhomme de chemin, voilà, jusqu'à l'échéance. Alors, qui a raison, qui a tort? L'avenir nous le dira, les amis. Personnellement, j'espère que c'est notre ami Eric Berg, que c'est le professeur de Boston College et que c'est Jean-Marie Dessin qui ont raison. Personnellement, je ne lâche rien. Ça veut dire que même si je pense, et je ne pense pas, quand je dis je ne pense pas, je ne sais pas si je suis guéri ou pas. Mais j'ai l'angoisse à chaque petit bobo que c'est mon cancer qui redémarre. Et surtout, les amis, je ne lâche rien. Ça veut dire le sucre, les viandes, tous les carbohydrates, tout ce qui peut être bon pour le cancer, je m'abstiens. Je continue mon régime cétogène amélioré, c'est-à-dire un peu moins de gras que dans le régime cétogène normal. Je n'ai pas 75% de gras. Mais je ne mange pas tout ce que le régime cétogène préconise de ne pas manger. Et pour l'instant, vous me regardez mes vidéos, regardez mes photos sur mon dossier médical, ou regardez mes premières vidéos de 2018 quand j'ai appris mon cancer. Et vous allez voir la différence entre avant et maintenant. Voilà les amis, j'en ne vous en dirai pas plus et je vous laisse avec notre ami Eric Berg. Au revoir.
We have a special guest today. Our guest has been interviewed before. His name is Guy Tenenbaum, and this is the guy who had stage 4 cancer. And I want to emphasize the word had, because now he doesn't have it. So I wanted to go through and just do an update on him and talk about some of the kind of before and after objective tests that he had done. He had a bone and joint imaging test. He also had a CAT scan of the chest, abdomen, and the lungs with contrast. And then he also had quite a few PSA testing. And he also had a prostate biopsy, which I'm getting all the data right now. I don't have that completed, so we still have to request some reports from the doc. So I'm not going to cover that little point, but I will cover some other things. So welcome, Guy. Welcome to this interview.
Thank you very much, Eric.
Absolutely. So when I did my last summit, you were actually in it. We did a whole interview, and we talked about like all the different things that you did, like the fasting and the foods and the nutrition. And I've also did a video. So if you haven't seen this interview in the past, I put a link down below so you can check it out again. But I wanted to just go through the before and after, if it's okay with you. And the first report, and I think it's going to be okay. I'll double check with this, but to actually provide a download link if someone wanted to actually visibly see these before and after records, I think you're going to make them available?
Yes, of course.
Okay,
I will
good.
give you everything. All my reports are easily accessible. And I ask also to have my report from friends accessible too.
Excellent. Yeah, because a couple comments, which is you're always going to get a couple in the crowd that says, "Oh, this is too hard to believe. Someone with stage 4 cancer, how could you possibly do anything with that?" Well, he did, and we have proof. And guess what? He's still alive, doing very well. So first thing I'm going to cover is the bone and joint imaging. The first test was done on 9/5/18. Okay, so that was what, a little over two years ago? Was it maybe 2 or 3 years ago?
Yes.
Okay, so and I'm going to just kind of cover the highlights there. There was an impression, which is kind of a summary. What they talk about, the impression was there was abnormal radio tracer uptake. Now, let me just kind of, as I go through this, I'm going to explain what all this means. When you have radio tracer uptake, basically this occurs with various pathologies. It could be a fracture, could be an infection, or it could be cancer. And in this case, it's cancer. So there's abnormal radio tracer uptake at the left, 2nd, and 7th ribs. Okay, so on the left side of your ribs, the 2nd through the 7th ribs. So this is 1, 2, come all the way down here to 7. T12. So there's the thoracic spine. That's where the T comes in. Starts from your mid back through here with like T1 all the way down to T12, which is at the very start of your lower back. So between his mid back and his lower back, the last thoracic vertebra is called T12, and this T12 retrievable body. So there's a problem there, and so what happened is the cancer spread from his prostate throughout different places in his body. It was a stage 4. Also, the right pubic bone had cancer in it as well. So the pubic bone is in the front part of the pelvis on the right side. There's 2 bones that connect, corresponding to osseous metastasis. So that's basically cancer of the bone. All right, that was in 9/5/18. So on 5/26/20, okay, this is what the impression was. Relatively stable, slightly improved osseous disease burden, no new suspicion focal activity identified. Okay, so that's a lot of wording for there wasn't anything spreading or remarkable or worsening or anything going on. So that's a good sign because they're just looking at the bones, okay?
Yes.
Now, let's go right to the CAT scan. So it's a different type of test. They use radiation for this. They did it at the chest, abdomen, the pelvis contrast. And this was done in 9/5/18, okay? So the impression was enlarged and heterogeneous, which means it's kind of the same throughout the prostate. We're talking about the prostate here. Enlarged and heterogeneous prostate with features detailed above. And I'm not going to get into all the little details because there's a lot of things, and you could read this in the report if you want. We'll allow you to download it. Because what they did is they took the left part, the top part, the right part, and they just talked about different things that were wrong. Anyway, I'm just getting to the point. Highly suggestive of local metastatic invasive prostatic adenocarcinoma. All right, that's a mouthful. Adenocarcinoma is a type of cancer that originates in the mucous membranes of glands. You can have that in the lungs, you have it in the breast, in the prostate, because there's glands there. So basically it's metastatic. There was cancer that invaded the prostate, and it involved the mucous glands. All right. He also said that the lower pelvic and retroperineal, okay, what does that mean? That means it's behind the peritoneum. Peritoneum is a kind of like a connective tissue that's right around the organs. So it's behind that, between the prostate and this little sheath of this little, I guess it's like a bag or a membrane that's holding everything, all the organs there. Okay, so we had lower pelvic and retroperitoneal. That's right behind that little sac. It's kind of deep, not quite inside the prostate, but just outside. Lymphadenopathy. Okay, so now what is that? That has to do with the lymph nodes. Okay, so we have a problem with the lymph nodes, as described above. Lymphadenopathy, which is a disease of the lymph nodes. So basically the lymph nodes are involved. The lymphatic system is where the cancer spreads and actually travels through, as described above. Now, in the report, you can read it for yourself. There's all sorts of details with nodules and the characteristics of the prostate and what's happening throughout the prostate. In this last point, it will kind of clear everything up. Overall, findings likely represent nodal, that's your lymph nodes, metastatic disease. Okay, so we have cancer throughout the lymph nodes. All right, that was 9/5/18. Fast forward to 7/13/20, okay, last year. Here's what the impression was. Stable pulmonary nodules. Okay, so that's nodules in the lung. Next one, stable left external iliac lymphadenopathy. Okay, so the lymph nodes are stable. We're not seeing anything growing, anything getting worse. And realize a CAT scan, you're not able to fully diagnose cancer, but you can see different changes that can occur from infection, healing, cancer, and things like that. All right, next one is stable osseous metastatic disease. Okay, so that is a very good indicator. We don't have any worsening. We're talking like a 2-year span. I mean, normally someone with stage 4 would die pretty rapidly, but we have stable osseous metastatic disease, which is very, very exciting. Okay, this last part is going to talk about the PSA test, which indicates cancer in many cases. It could also mean other things, but check this out. In 9/11/2018, his PSA, the total PSA, was 87. Now, a normal PSA is 0.01 to 4.0. Okay, his was 87. And as you can see in this chart, it dropped dramatically. So in 9/9/2019, it was 0.4, and then in 10/10/2019, it was 0.21, within normal range. You can see there's so many good indicators, not just that he's alive, he's doing well, but there's all these indicators showing he's doing better and better and better. So I just wanted to give everyone an update on how he's doing and talk about some of the before and afters. And just to let you guys know that he's alive and well. And we will be doing another video as soon as I get this biopsy, because I want to also talk more about that. And we will get a report from the doctor just summarizing his overall progress and how he's doing and his prognosis in the future, because all the indicators show that he's doing fantastic inside and out, and that's just remarkable. So it just goes to show you the power of good nutrition, the power of fasting. That's one thing that Guy has mastered, and he has a whole protocol. We've talked about in other videos. You can check it out. But anyway, I wanted to just mention that. And Guy, would you like to add anything to what I just mentioned that or maybe I forgot to mention?
Since I had my PSA drop to 0.1,
Oh, wow.
it stayed 0.1. And I think I don't understand why the doctor, the oncologist, doesn't be surprised of 0.1. 0.1, you have it when you have no more prostate. But I have my prostate and I have 0.1. I think it's an opportunity for the science to understand what I did to save people.
So can I just ask a question about that? Because you're talking to an oncologist, a doctor who specializes in cancer all day long, and then you come along and it's a miracle, stage 4. Now all these indicators show. I mean, if I was a doctor and seeing these changes, I would know, what are you doing? Let me suggest this to my patients. Has he said anything like, did he ask about what you're eating? Was he interested in knowing more about that? Or was he kind of like, okay, yeah, we'll just see how you do. What was his take on that?
It's difficult because they are nice guys.
Yeah.
But I don't understand okay, you did some, okay, it's good, you are well, okay. So, but searching to find what I did, when I start explaining, finish. Nobody in front of me.
Yeah, unfortunately, it's that was an experience that I wish more doctors would be like, wow, let's learn about what you did. I mean, in practice, I learned so much from my clients. I mean, some of the things that they did and they taught me, it's incredible. I mean, you have a chance to interact with tens of thousands of people over 29 years and just going, let's see what really works, what doesn't work, and then suggest that for the next patient that comes in. So anyway, the good news is that you started a YouTube channel. You have, how many subscribers do you have on your YouTube channel now?
35,000, but I have just a little bit less than 7 million views.
That's pretty good.
And with a friend of mine in France, we have, he take care of that, an association with 3,500 sick people from cancer. And imagine what, since our last discovery, nobody is dead.
Wow.
Nobody.
Wow. Wow. Yes. So Guy is constantly researching, getting valuable information and sharing that with all of his people. And it's actually in French, but we are collaborating a lot, and we're just getting a lot of information for people. We're going to do some studies here soon so we can really validate these ideas and these things that you've done, so we can then, bring it to the world. So anyway, I just wanted to touch on this. Thank you so much for allow me to ask these questions, and stay tuned for some updates soon after we get some additional reports from the doc. All right,
Thank you very much.
My pleasure.
And have a good weekend.
Okay, you too.
Alors, vous avez vu, et mon goal aujourd'hui, c'est d'aider, c'est de trouver des gens en France, dans d'autres pays, mais surtout en France, parce qu'un tel aveuglement, je n'arrive pas à comprendre. J'ai écrit un livre, j'ai interrogé tous les organismes qui s'occupent de cancer pour arriver à leur faire comprendre qu'il y a quelque chose à découvrir dans ce que j'ai fait pour aider les autres. Je vous rappelle qu'il y a 200 000 morts du cancer en France et j'espère que des médecins que je contacte journellement vont finir par adopter et faire connaître ce que j'ai fait, étudier ce que j'ai fait pour comprendre comment sauver d'autres personnes. En attendant, les amis, deuxième vidéo qui va suivre après celle-ci, c'est la vidéo faite avec Eric Berg où je détaille, elle a son anglais aussi, où je détaille exactement tout ce que j'ai fait, les amis, tout ce que j'ai fait, tout ce que j'ai bu, tout ce que j'ai mangé, tout ce que je prends comme nutriments, en espérant que ça puisse vous aider avec l'accord de votre médecin. Merci les amis, au revoir.